Anna was initially brought to me for treatment of sleep apnea. She was given a CPAP machine as a young girl, and basically the parents were told that's it, they're going to have to use that CPAP for life. Mum and Dad came and saw me for a second opinion, and I said, look, definitely the CPAP's important at this stage, but we want to wean her off that. And the way I did that, we expanded Anna's upper jaw. That improved her nasal breathing. We got obviously ear, nose and throat involvement for her tonsils adenoids. And then we brought her lower jaw forward using a device called a MARA. If you look at that nice palate, and you'll see the initial photos in a minute, you'll see the big difference in the palate change. This is the MARA. It's basically an arm on the lower molar. So when the patient bites, it's pushing the jaw forward. And you can see now the lower jaw is in a good position, which has opened up the oropharynx. We've had improvement in the nasopharynx area because of what we did with expansion and face mask therapy. Now, we will get to lining her teeth when she's a little bit older, but the focus is not on orthodontics. The focus is on orthopedics and the sleep apnea. You can see the large adenoids and the class 2 jaw with the very narrow airway. And just from a dental point of view, there's no way those teeth would have had any space. When I graduated from orthodontic school, we were taught when you see crowding like that, you pull out 4 teeth, you put braces on. Pulling teeth out is going to make the jaw narrow. It's going to worsen her sleep problems. So what we've done is widen the palate to make room for the teeth, bring the maxilla forward with a face mask, and the mandible forward with a MARA. So we're opening up all these parts of the pharynx that normally would be obstructed, and that's got her off her CPAP. So she started as a young girl in my office. You can see the overclosed vertical dimension and the class 2 bite. Low incisors biting almost complete to the palate. Now, you just saw the palate expansion. Have a look at where we started. High palatal vault, like a double layer of teeth. Right? So there's a big improvement for orthodontists to realize what they can do to make room for the teeth, but there's even bigger issue for medical practitioners to understand what orthopedics can do for the management of pediatric sleep apnea. If you look at the latest research, Maria has published extensively on this topic, which is pediatric obstructive sleep apnea using oral appliances. And what she discusses in this excellent article, which is part of the European Respiratory Society's actual guidelines, is how orthodontic treatment in children with expansion of the palate should be one of the first lines of treatment for patients, as opposed to the older approach, which was simply to put everyone on a CPAP. And I'm happy if anyone who's watching this wants a copy of this article to send them that, because it's an excellent read that allows people to understand you do need CPAP, but you don't want to keep people on CPAP forever. And the benefit of a growing individual is you can actually modify the size, shape, and position of their jaws to improve their airway.